Trigeminal neuralgia. That's the topic for today. Now, in the head, totally you have 12 important cranial nerves. Out of that, the fifth cranial nerve is trigeminal nerve. So, if you have pain in the area of distribution of the fifth cranial nerve that is related to the nerve, then it is called as neuralgia. That is trigeminal neuralgia. And it commonly affects above the age of 50, and it is very less common below the age of 30. So, only in one condition it affects younger age group, that is in multiple sclerosis. Otherwise, usually it affects above the age of 50, and it is more common so in females. So, this trigeminal, tri means 3, trigeminal nerve, it has the area of distribution, the sensation it takes, it supplies this area here, then the second area is this, and this is the third area, and the second one, this area is the commonest area to be involved. So, the presentation, the complaint of the patient. The patients usually complain with sudden onset of severe, unbearable, lancinating, excruciating pain. It's so severe, the patient forgets about the surrounding and he just sits down holding the face. And they are afraid to hold the face also. Why? Because the provoking factors, if by simple touch of that area, it can stimulate the pain. Or a smile, or they are trying to, there's the movement of this, they are trying to apply something on the face. Or simple air current which hits the face. Simple things can aggravate the pain. And it usually lasts for seconds or maybe a minute or so. That's all. Then after that he will be pain free. But this recurs same day he gets multiple episodes. That is, it can have maybe more than 50 times in a single day. So, just imagine one single episode he is not able to manage, and the same person he is getting about 50 episodes per day, which is one episode is it's unbearable, excruciating pain. It's very severe pain. Now, let me tell you something. See, I'll take you back to 1912, those days. So, during those days, we don't have so much of medications which I'm going to tell you in detail. That is, you don't have so much of medications, you don't have so much of surgical options. So, those patients who are suffering from trigeminal neuralgia, because of this pain, they are not able to bear the pain, they used to commit suicide. So, it was so unbearable. So, the other name for this disease is suicide disease. But now it's not the condition. Now things have changed. We have so many different alternative treatment, we have medical treatment, we have surgical options. Let us see all that. So, I have told you the common presentation. So, we have to examine the patient. The problem on examination is he will not allow us to touch. Why? Because just by simple touch will provoke the pain, and it is unbearable, excruciating pain. But we have to examine. Why? Because this trigeminal neuralgia, there are two types. One is primary, another one is secondary. So, primary means the cause is not known. So, let me tell you the secondary. So, the trigeminal nerve, when it starts from the brain and comes out before it reaches the face, the full course I mean to say, somewhere in the course, an artery is a tube or a vessel which takes blood. One artery is compressing, it's compressing on the nerve. So, what happens is, the covering of the nerve is getting destroyed. So, let me tell you a small example. So, at home you you must have seen electrical wires. So, the electrical wire, you have got a copper wire inside which is covered by a insulation outside, is it not? So, just imagine you have 2-3 wires together. The whole thing is one unit, okay? That is a trigeminal nerve. So, you have 2-3 wires inside. In that one wire, the covering, the insulation wire, suppose you imagine it is gone, destroyed, and the copper wire is exposed, and you have the flow of current. So, what will happen? There will be a flow of current and there will be a leak of current, and it will affect the current flow will not be proper in that particular wire, and that will be affect the nearby wires too. So, exactly that is what is happening here. So, what happens when the leak of current, it affects the nearby area, which is the normal nerve which has to conduct any sensation. So, what happens? The when the wire is destroyed, all the impulses, it goes to the neighboring wires within the same unit, and all these are conducted to the brain. So, a simple touch or any sensation, it is noted as a severe pain for the patient. That is what is happening. So, the pathology is that you have an artery pressing on the nerve, or maybe it's some other benign condition, not malignant, maybe, but usually benign condition, like you have vestibular schwannoma, meningioma, it's pressing on the vessel, or there is one condition which affects the less than 30 years, that is multiple sclerosis, where the covering of the nerve is destroyed. So, these are the secondary causes for that. So, why I am telling you this is, if you have a secondary cause, the sensation, if you ask the patient to close the eyes and you touch with the cotton, he will not be able to know. When you compare to the other side, the patient will be losing the sensation here. Likewise, this trigeminal nerve, by the way, it supplies nerves of mastication too. So, you have loss of motor function, it does not work properly, and the sensation too is lost. This is mainly in the secondary form. So, we have to examine the patient to know that too. Now, coming to the diagnosis. So, the main investigation which is for diagnosis is MRI and plus or minus MRI scan. So, that we come MRA scan. So, that we can come to know which vessel is compressing on the nerve. That is the main. So, other investigations, these are for the proper treatment, that is done. Now, coming to the treatment. So, treatment, let us divide into 4 different types. One is counseling, second is medical treatment, management, third is surgical management, there is surgery, and last is other modalities. So, in counseling, so we like to tell you that it's a curable condition, not like those days, it's a curable condition, though it takes time. Why does it take time? Because the medicines which you are going to prescribe for this, it's all anticonvulsants, the medication which is given to prevent convulsions, you know. So, these are strong medications, and we used to start with the lowest dose possible, not with the high dose. So, to reach the level to control your pain, we have to slowly increase the dose, and this dose, once it reaches the dose, the pain is well under control, we have to take it for a long time, then you slowly taper it off. It takes time. So, you have to be patient, has to be very patient. That is the most important thing. Now, coming to the treatment. So, you have a long list of treatment. I have just skipped to the treatment part because there is a patient education program where the treatment should not be, the tablet should not be told in detail. That is why I have just skipped it off. But for a second, you must have seen there is a long list of all the medications, is it not? Long list. So, by the way, all these medications will be prescribed by the doctor. Any one of these will be prescribed by the doctor, and you just cannot get over the counter because the pharmacist will not give you. These are all strong medications. Okay. Now, this condition, trigeminal neuralgia, will be managed by a team of doctors from different departments. It is not ENT alone. You need a neurologist. He will take care of all the medications. We have a neurosurgeon along with us in the team, because if there is a surgical management, that is microvascular decompression, which I will tell you shortly, we need the help of neurosurgeon. And what happens is, when the pain which is lasting for a long duration, maybe it will take months or years to get controlled, so the patient goes in a stage of depression. There is a possibility. In that case, the patient needs antidepressants and counseling. So, we get the help of psychiatrist. And of course, we need the most important person, the pain clinic. Why? Because the pain management, we cannot give the strongest medication the first dose. We start with a mild one, then slowly escalate the dose and you go to the stronger one. So, the pain part will be mainly managed by the pain clinic department. So, you have 4 to 5 departments working in one patient, just imagine. So, why? Because the treatment takes time, and he needs a lot of counseling, and it takes time to cure also. That is why. Now, coming to the surgery. So, most of the patients, it will be managed medically. So, I have told you there are 2 types. One is primary, secondary. So, primary, you do not have a cause. So, there what happens is the nerve gets hyperexcitable. That is the main problem with the patient. Secondary, we have a cause, so that can be removed. So, what happens is, suppose this is a nerve and this is an artery, it is touching it. So, it is compressing on the nerve. So the surgical treatment is you have to decompress the nerve. So microvascular decompression. So that's where you have the neurosurgeon coming into. So that's a major surgery, and he will try to decompress. He will try to put some fascia in between the artery and the nerve, or some Teflon in between the artery and the nerve, so that the nerve doesn't compress on the artery. Now the other modalities, that is it's invasive procedure, but not like the microvascular decompression, but destructive. These are what you can do at the root of the nerve. Root, the rhizo means root. There we inject something so that we destroy it. Tomy means to cut off. We destroy it. So it is chemical. We inject some chemical. So chemical rhizotomy. So what do you inject? We inject glycerin and phenol or alcohol. These are the common ones. Or the next alternative is we have radiofrequency thermorhizotomy. At a particular temperature, which is placed, the probe is placed here, and a particular temperature we used to, by technique of radiofrequency, this root is destroyed. That is another technique. And the third one is we have balloon microdecompression. And even there is an option that we give a radiation. First, we take a mapping with the help of an MRI, and we know where to focus the beam of radiation, and that cobalt-60 radiation is focused on that particular part, root, and we will expose the patient. That is called as stereotactically controlled that is temperature coagulation. That is also an alternative. So these are the different surgical alternatives. Now the other techniques are, we can make use of TENS, transcutaneous electrical nerve stimulation, and some patients can be helped with acupuncture. And simple application of this cream, capsaicin cream, and the local area, it may help. Or even this aspirin tablets, it has to be powdered well and mixed with some facial cream and locally applied in that particular area. So that also may help. So now in this condition, the main take home message is the treatment takes time, and you have to meet different doctors in different departments. So I repeat, the patient needs a lot of patience, but surely you will be rewarded for that. Because why I'm saying is, there is a cure for it. There are so many alternatives. There so many medications, new medications also coming up. Even for a second I showed you a long list. So they have so many combination of medications. So all these can help you, but it takes time. So this is what I want to tell you about trigeminal neuralgia. Thank you so much.